You're watching Eyewitness, the Print's daily COVID live feature covering the coronavirus pandemic. I'm Jyoti Malhotra in Delhi, and today I have with me the Print's correspondent in Andhra Pradesh, Rishika Sadam, is based in Hyderabad, but right now she's in Ongole. You can see the lovely, beautiful beach on the Bay of Bengal right behind you, Rishika. Tell me exactly where you are and why you're here.
So we've been touring Andhra Pradesh to cover the COVID crisis. And for the past couple of days, we've been in Vijayawada looking at how cases have been. Now, Vijayawada is quite close to the capital region, one of the capital that the chief minister had proposed, that the three capitals for Andhra Pradesh, that's Vizag, Amravati, and then Kurnool. So Amravati happens to be one of them. Amravati was also the capital that was proposed by the former chief minister as a single capital to the state. So Vijayawada is like the political hub of Andhra Pradesh. So we've spent there for the last few days looking at how COVID crisis has been, and a lot of villages in and around Vijayawada and Guntur district, and the hospitals, particularly in the town, they have been extremely overcrowded. But coming later to that part, from there we've come to Ongole now, the next district, right from Vijayawada. If we move to Guntur and then Prakasam, this is Prakasam district, and particularly we are closer, just 20 kilometers away, 25 kilometers away from Ongole town. This is the Kottapatnam area. We've been looking at few villages in and around Ongole town, particularly how the spread in rural areas is. So it appears to be that in different locations of rural parts of Andhra Pradesh, there's a different kind of spread, or we are noticing there's a different pattern. So here, that's it. We are here at Kottapatnam today, closer to the Ongole town. Now, which is in Prakasam district, Prakasam happens to be one of the worst affected districts of Andhra Pradesh when it comes to COVID.
Right. So viewers, I would encourage you to send your questions over the next half an hour or so. Rishika will be answering all the questions on Andhra Pradesh, on the situation of the COVID pandemic, how Andhra Pradesh is dealing with it. Rishika, the first question from me is that right now positivity rates in Andhra are really high, above 20%. In fact, it's one of the worst in the country. Can you explain why?
Now, quick background. Let's look at how Andhra has picked up, or how the infection in Andhra has picked up over the last few months. When we look at the second wave, what started at the beginning of April, what was a single-digit positivity rate, 3%, 4%, or 9%. Now that is shot up to 23 to 24%. We can say the state is literally going through a peak. And for the last 2 weeks, there's been a very stringent lockdown. The relaxation is only from 6 a.m. to 12. And post that, we've been looking at all the areas and roads, which is extremely stringent lockdown. Right. The reasons why Andhra has come to this level. Now, there are multiple factors here. Previously, also, sometime during in mid-April, Andhra has touched a high positivity rate of 25, but then they managed to get it down. What happened later? Lot of factors. First thing is, a lot of people travel to nearby states, particularly Telangana, Hyderabad, in terms of for business, for work, for education. So traveling and migration is a lot in Andhra Pradesh compared to the neighboring state, at least. For instance, the border, Tamil Nadu is Andhra's border. From Tirupati, Chennai is quite close. Then we go to the extreme Anantapur border district of Andhra Pradesh, from where Karnataka is not too far. And again, let me tell you, both Telangana and Andhra Pradesh have been together for at one point of time. It was an erstwhile Andhra Pradesh. Yes. So the connectivity between both Telugu states has been there for decades or years now. So the migration for work or for families, that keeps happening regularly. From Vijayawada to Hyderabad, it's roughly 4.5 hours, about 200 just at that point, 4.5 hours. So that traveling has actually increased the level of infection, because a lot of people traveling Tamil Nadu, a lot of people traveling Karnataka, and then Telangana. So it's from the other states. That's one factor. Now, different villages in Andhra Pradesh have a different structure. So let's talk about the first villages in and around Vijayawada, Guntur district. Guntur also happens to be one of the worst affected districts, but villages, specifically in the Amravati capital region, which falls on the banks of Krishna district and Guntur, Krishna River and Guntur, people there are quite well settled economically, financially. So they have a lot of connectivity with Hyderabad as well, and also other districts in the state. So that also happens a lot. So this particular thing of traveling a lot within other states, that's one of the reasons why Andhra Pradesh has shot up. The state has had elections also. There were local body elections sometime in March, and a bypoll in Tirupati, one of the important constituencies. So that also probably could have contributed to the infection. and reacting late to it. By then, the spread in the rural areas was a lot. So the lockdown came in quite late when the state almost touched the peak.
Right. Rishika, one of the most interesting stories that you've written so far on the print website has been the one about the 18-year-old tribal, the young man, who could not find an COVID isolation center after he was tested positive, and therefore he climbed a tree and he made a bed and he sort of tied his bed to the tree, to the branches of the tree, and there he isolated there for a couple of weeks. I mean, that was quite an incredible picture. So can you tell us a little bit about this?
Yes, definitely, Jyoti. I'd like to tell the viewers that this is, in fact, a good news that the man's tested negative. After our report, he was taken to an nearby isolation center where he spent 2-3 days. We've been in constant touch with him and the family. And he'd messaged me, in fact, late last night saying that he's tested negative. So he's going to come back home. The family is also a lot happy. Now, why am I saying the family is
That's
happy is
fantastic news, Rishika. That's
it
really
is, it is indeed, indeed. Now, there's a lot of stigma about isolation centers as well. So we get into this story. This is from Telangana's district, the neighboring district of Andhra Pradesh, and in
right.
a district, sorry, neighboring state of Andhra Pradesh, and in a district called Nalgonda. And Nalgonda is also, quite close to Hyderabad, 3 hours. But this particular tribal hamlet was in the interiors of Nalgonda. It's called Kottanandikonda, where we found this man who was isolating on a tree. He's an 18-year-old student studying in Hyderabad. But since the cases were increasing rapidly in the city, he decided to go back home almost a month and a half ago. So when he tested positive, the family wasn't aware of any nearby isolation center. In fact, there was no isolation center for the entire mandal. Only up until 2-3 days ago, I mean, after he completed 11 days of isolation, there was an isolation center set up in a nearby SCST hostel, which even the people of the hamlet weren't aware. So the only option he was left was to probably look at the tree. In a way, it's quite innovative. In a way, it's not
Yes,
losing hope and
absolutely.
probably doing that. But
Yeah.
also, it highlights how pathetic our rural infrastructure is. He has a phone. When I called him when I called him wanting to reach out to that place, he told me very clearly Google Maps works up until a particular level. You can reach the mandal. From there, I can guide you. But nobody in the village had, or in fact wanted to question about the rural health infrastructure. So he made a makeshift bed with the bamboo sticks and the mattress, and he spent 11 days. In fact, he made a tiny basket that he tied to the tree where he kept
Yeah,
his
I
phone.
saw that. Yes.
Yes, so that was a story from there. And after that, he was moved to the isolation center. Now, the nearby PHC, the primary healthcare center to that hamlet, is about 6 kilometers away. And
Mhm.
there are hardly a doctor or two. And there are 300 houses in this particular hamlet only. And nearby, when we toured, there are a couple of other hamlets who all of them depend on that one primary healthcare center.
I see. Now that was a really remarkable story. It was so, it just brought in all the elements of COVID together. This young man, tribal, studying in Hyderabad. So obviously he wants to study and he wants to improve his lot in life. Coming back, realizing that he cannot go to an isolation center. So what does he do next? He just climbs a tree and then he isolates. I think it was quite an incredible story. But some questions have come in now for you, Rishika. The first is by Chamarti Suhas, who's asking, are cases in Andhra being underreported?
So we have done this story about deaths being underreported. Now, when it comes to cases, compared to Telangana, Andhra has been testing better. Their testing rate has been constant. They haven't reduced it. They go up to a 90,000. Then they say the positivity rate is 23%. We've toured a couple of villages in Andhra Pradesh as well, where we observed this particular thing specifically in the rural belt, that a lot of people, due to the stigma, do not really want to get tested at the government centers. They slowly move away to the private centers. Private numbers still get reported
What
anyway.
is the
But
stigma about, Rishika? I don't understand the stigma.
now we have to
A
understand
lot
that
of you reporters have across the country keep saying that there is a COVID stigma. What is the stigma?
when I personally spoke to multiple families, say
Yeah.
easily about 50 families over the last 4 days, these are in the rural interior areas of Guntur district or in and around Vijayawada, smaller areas in and around Vijayawada. They talk about stigma, the stigma being the neighbor would probably look down on me. In fact, when I went to the Telangana's hamlet where the boys isolated on the tree,
Yeah.
up until we reached with the crew, half of the hamlet did not know he was isolating on the tree and the family was not comfortable talking about it. When asked why, in fact, that's not the only incident there. There were people isolating in fields, in the bathrooms, not telling anybody. They say you go to the local grocery shop, the person there says, just move away, stand at a distance, even after you recover. This is about after recovery. And then you just go to a local gathering where a couple of people are sitting, then they don't really welcome you. One should understand in the rural areas, it's quite common in the evening that the locals just get together, sit down, talk. Although now, due to COVID, that's really stopped. But even in smaller gatherings, they're not welcome. The neighbors don't really interact. These are something that we picked up, which so a lot of people do not want to come out and tell. A lot of people do not want to get tested. So they silently isolate just looking at the symptoms. So it's not, when it comes to underreporting, there could be a lot of cases that the government could not be aware of, specifically in the rural areas. But in the towns and cities, we are seeing how the labs and the government centers are already burdened with the number of people who are getting tested,
Yeah.
proportional to the number of beds that are already being occupied also.
I mean, when you talk about this stigma, it seems to me, Rishika, that there's such a lack of awareness. But I mean, obviously, you can understand the fear and apprehension on the part of people around COVID positive people is that you don't want to come in contact with them because you may sort of pick up, some. Now we know that it's an airborne disease, an airborne infection. So you don't want to be too close to COVID infected people. In any case, they are supposed to be isolating. But I wish that there was greater awareness. But there's a couple of more questions coming in for you, Rishika, which is Ranadhir Gaud is asking, is the government distributing corona kits to all, irrespective of whether you're positive or negative?
So the COVID home isolation kits are given to people if you test positive and you are under home isolation. These are being done extremely at the ward and the village level as well. So every day when the panchayat reports to the state health department, the kits are deployed. So yes, in both the states, once a person tests positive and he or she is on the government record. Now that is also very important. You might get tested from a private lab, and by the time that data reaches the government, it might take a couple of days. We've seen it takes 4 days easily by the time they update the records. So once you come into the government records, the kits are obviously being distributed to the people who have
What is
tested
a
positive.
COVID kit? What does it have?
It now, when it comes to Telangana, it has a set of basic medicines, which was recently upgraded as well.
Yeah.
But in Andhra Pradesh, this has been continuing since 2020, where you have a couple of medicines, a couple of vitamin medicines, and then probably you're also given a thermometer to check your temperature. So it's a basic home isolation kit that we are looking at.
But in Kerala, for example, they don't perhaps call it a corona kit, but what they are doing is that volunteers, whether it's from the government or from the party, they're going to the homes of people and giving them sort of basic, ration, sort of food rations, whether it's dal or rice or fish. So does Andhra have any equivalent of that?
Both the states, when things, they went into a lockdown in 2020, yes, all of this happened, especially for the BPL families. Both the states had made ration free, although it wasn't initially what started off at the ration shops, but due to the crowding, they decentralized it a lot more with volunteers and all of it. So that's been, in fact, the Telangana government recently had upgraded, and they said they would be doing the same thing for the BPL, for the white ration card holders. Andhra Pradesh also has similar schemes continuing. There are a lot of welfare schemes in Andhra Pradesh, the direct cash transfer schemes, which almost 27 welfare schemes in Andhra Pradesh. Those have also been continuing. Now, the state government, ever since the chief minister came to power in 2019 May, from then to now, they spent almost 80,000 crore on welfare scheme. This could be about education. This could be about basic necessities. So all of this are also continuing in the state.
This is in Andhra you're talking about?
Yes. Yes.
Okay. Because there's a connected question where the question is, I think you've partially answered the question already, which is that is there any financial stimulus being given to poor people who test positive?
So the Andhra state government, for instance, to perform last rites of a COVID patient, we also see a lot of stigma around that, right? So especially in the rural belt. Now, the Andhra Pradesh government has given 15,000 rupees for everyone performing the last rites of a particular COVID patient. So that would be individually given. Apart from that, in 2020, which I believe even now they can look at those things. In 2020, when in the initial days of COVID and the pandemic. The state government has also said that people who come out from isolation centers would be rewarded a cash prize. People who test positive and get registered in the government records would be awarded a cash prize. So those have also been on in Andhra Pradesh since then.
Okay. Dilip Kumar Reddy is asking, Rishika, is the volunteer system introduced in Andhra Pradesh working in this crisis? So if you can explain what this volunteer system is.
So yes, this is where I've gone to a couple of panchayat equivalents in Andhra Pradesh. Now, what the Andhra government has done is they've got something called a Gram Sachivalayam, a Gram level secretariat. That is an upgrade of a panchayat, where from a panchayat staff could be 5, 6 people, they've upgraded to 9, 10 people. They've set up young volunteers in every village, about 4 to 5 volunteers. These volunteers not just take care of schemes. So ideally, in an ideal case, in an earlier panchayat, a senior citizen who had to take the pension has to come to the panchayat office. They have to get registered and take the panchayat on pension on a certain day and go back. Now
Right.
these volunteers, it's all a digital system. They register them, go door to door, and when the pension amount releases, they go door to door, hand it over. And also, if a senior citizen based on a particular village, but he or she had to travel to another village for some purpose, they can collect the pension in that particular village. All they have to do is just go meet the volunteer. They'll come, check the records, and give it off at their particular door. Apart from that, a lot of welfare schemes for the backward, for the poor, we are looking at in terms of financial assistance, in terms of, for instance, there's a scheme called Ammavadi, which basically is a financial assistance provided to a mother who sends a child to the school. So those kind of all those scheme execution is also being done by the volunteers. So to an extent, yes, it is working, particularly in the rural, extreme rural parts. This would be, it will be a lot more of decentralization in that way.
No, but in the COVID, for COVID, is it working in the COVID areas? Meaning people who have been tested positive, are these volunteers going to their homes and giving them their kits and other rations and advising them to be isolated and and to follow the other sort of COVID protocols?
Now, Andhra Pradesh has a really strong network of ASHA and ANM workers and village volunteers. In fact, they were one of the first people in 2020 also to deploy them to do these fever surveys and go door to door talk about it. So yes, that's continuing in 2021 as well. So ASHA workers, ANM workers who do these fever surveys all the time regularly, and once they notice a particular person has symptoms, even though he or she has not tested positive, basic medicines are given to them. So each village, depending on the size and population, has a couple of ASHA workers and ANM workers who together form a sub-center health center, which are, it's a sub-health center. So it could
Right.
be 5 to 6 ASHA workers who cover, days who cover houses every day.
Okay, so I asked you about the infection, the positivity rate, and you explained why it's so high. But what about the mortality rate? How high is that? And is the government concerned about this? I mean,
The
obviously,
death
the
rate
government is concerned, but I just want to know about how that compares.
The death rate is also pretty high in Andhra compared to Telangana again. But also, we've seen an increase in the death rate, how we've seen an increase in the infection. In fact, we've also done a story recently where we visited large crematoriums in Vijayawada and 3 burial grounds for 2 days. And we've looked at every body that's coming in, checking receipts to find that the death numbers mentioned in the state bulletin the actual reality on the ground is quite different. The crematorium numbers outnumber the state bulletin numbers in a large way. Now, a couple of districts, particularly Krishna district, the death number is a single digit. The bulletin reports 8, 9 deaths on an average. Sometimes it goes to 10. But only one particular crematorium in Vijayawada city, which falls under the Krishna district, like the entire district, only one particular crematorium in a city had 22 bodies. We checked the slips, we checked the death slips where they were admitted. Now these are all people coming from nearby villages also. Like I told you, a lot of villages depend on the town even for a bed. Even a
Right.
PHC is not equipped to do that. So death rate is also a very big concern in Andhra at this point of time. But the state imposed lockdown 2 weeks ago. And when we spoke to heads of these crematoriums or the office in charge who run these crematoriums, they say before the lockdown, especially in the May first week towards 6th and 7th, they used to probably cremate about 40 bodies on an average in a week and on a day, sorry, 40 bodies. But now it's come down to 22. So they say lockdown somewhere around could have helped in cutting down the infection rate or the severity, although we cannot directly link it. but it's their personal observation that they see that there's a slight decline in the deaths that we are seeing, especially during the lockdown.
But just bear with me, Rishika. I want to go back to your story, what you were just telling me about this particular crematorium and burial ground, and you were matching the reported figures to what you saw on the ground. But if the parchi, or if the slip, the registration slip or the token that we have, we call it a token in North India, if the government is issuing a token or a slip, then shouldn't that match with the official record? So I don't understand how the underreporting takes place.
Now, crematoriums, a few of them are directly managed by the municipal corporation.
I see. Okay.
And few of them are private, but all of them mostly are supposed to give their numbers to the municipal corporation.
Sure.
Now, few of them are really small. They're private. They could probably see 2 or 3 deaths a day, and then they could, give the data together to the VMC. But the large places are controlled by VMC. So when we spoke to the people running the crematorium, they say we do give these figures, the register which we saw, which had 22 bodies a day, and when we counted the same, staying the whole day, they say we give all of these numbers to the VMC. When we cross-checked with the Vijayawada Municipal Corporation, that's where the mismatch appears. The official figures are a lot lower from what these hard paper registers are there at the crematoriums and the burial grounds.
What do you think they do? Do they just, sort of physically reduce the numbers? What do you think they do?
See, this is where the criticism of underreporting to the government comes, because if the entire district can have 8 deaths, supposedly the entire district has 8 deaths. Now, there's also an argument that Vijayawada is located in such a way that it's on people from Guntur also come to Vijayawada, and people from the same district, Krishna, also come. So let's look at both the districts together, they're combining both the districts together. Still, the total number of deaths is only 18. We are talking about May 17 figures, just to put this into perspective. Yeah. Still, the total number of deaths were only 18 in the entire 2 districts. But one crematorium in a city.
Is it?
No, it's 1-8. 1-8.
Okay.
Yes. So, but one crematorium in a city has 22 deaths. This is a large crematorium I'm talking about. They're of different sizes. There are at least 50 other crematoriums in Vijayawada. So one can imagine the magnitude of deaths. But that being said, it is also this thing that Vijayawada is like the hub where people from farthest of districts also come. That still does not equate what we saw in a day at these crematoriums. So that is where the whole allegation and criticism of underreporting the deaths has come to Andhra Pradesh as well.
So how are they explaining it, Rishika? How are the authorities explaining that? Are they saying that, for example, if people or patients from other districts are also coming to Vijayawada, then perhaps those deaths are being reported in their respective home districts? Is that possible?
Yes, see, one excuse that's being given is a lot of people from different villages, not just the Guntur and Krishna districts, but far off Rajahmundry districts, or people from a few Telangana bordering districts also come here, get treated, they die. So those numbers are something that you could be looking at. But we've personally verified all these numbers that we are talking about, the 22 bodies in one crematorium or the 9 bodies in VMC's own crematorium. There's a crematorium called Swargapuri that's probably one of the largest in the city, Vijayawada, that's run by the municipal corporation. Those figures we've looked at, the death slips, where they say that the people are residents of the city or else nearby villages. So one excuse coming in is you might be looking at people from other villages or states, but we have cross-checked. Although there are a lot of people from other villages and states, but these numbers are of people who have died in and around in the same district at least. That's how we are comparing it. And another excuse that comes from the government is, we don't have any reason to underreport, probably because the timing could be a little different. So we'll include it a day later. But we've done a week full comparison. That's not the situation at all.
Right, viewers. I mean, I think this is remarkable reporting by Rishika. So please go to the Print website, ThePrint.in. So it's ThePrint, which is one word, .in, and please read Rishika's stories. A couple of more questions that have come in, Rishika. There's one about vaccinations. So Pihu is asking, what is the story about vaccinations in the States? Can you give me some idea? He wants to know about the Pihu. I'm not sure if it's a male or female. I'm sorry if I made a mistake there. But Pihu wants to know what the problems are, and also the division between the 18 to 45 age group and the ones 45 and above.
So now when it comes to vaccination and what's going on in Andhra Pradesh particularly, I'm telling you, when the slots for 18 and above opened up, at that point of time, the chief minister had openly spoken about the supply and the demand for the vaccines. And it clearly said by the time state decides to vaccinate people above 18, it would be September. That's exactly what he said. September is the time when we could vaccinate, because you'll have to complete the second doses of senior citizens and then 45 people above 45, then move to the next category. So that's somewhere around, at least up until May, there's no clarity. 18 above vaccinations are not happening here. As of now, Andhra Pradesh is prioritized only second doses. The state says they have a capacity to vaccinate 6 to 8 lakh a day, at least, or easily. But due to the shortage of supply, they are being made to vaccinate whosoever they can, especially in the rural areas. Now, the plan of the chief minister was also to arrange vaccination centers in these gram sachivalayams that I mentioned earlier during this
Sorry
speech.
to interrupt you, Rishika, but are you saying that the priority is to vaccinate in rural rather than urban?
No, that's not the case. It's both ways. There's a balance between rural and urban as well. But the priority is only for second doses at the moment. That is for people above 45 and the senior citizens who are probably left out.
18 to 45 is not being vaccinated at all.
No, neither in Telangana that's happening, nor in Andhra Pradesh. The chief minister had already made a statement a lot earlier that practically, if you look at the scenario of the state's demand and the supply that's being getting in, it would probably go up until September, where we could conveniently vaccinate 18 above. But the state also doesn't want to wait that long. As long as the supply is intact, they can go around vaccinating, is what they say.
I mean, of course, senior citizens, and basically you have to vaccinate those who are in the greatest need of that vaccine. We know that. But surely, so you have not been vaccinated, Rishika.
No, I don't. I am not vaccinated.
I see. So the question is that a lot of young people are also falling prey to this infection, and a lot of young people, between the 18 to 45 age group are also dying. So I'm just wondering as a journalist like you, that they should perhaps give the first dose to a larger number of people and then wait for the second dose.
That's an argument that we can look at, but also what's happening is
that's not what the government is looking at, right?
That's not, because when you open up vaccination, a lot of people who are being left out now, a lot of people, it's way above. Now, this was when the earlier duration was 45 days or 30 days. I'm talking about that time. There was extreme crowding at centers. In fact, in one of the Narsaraopet town comes under Guntur, where we saw people just pushing each other, and hundreds reached when they said the vaccination was going on, Covaxin was being set up at that particular center. So they say if we go in an order, we probably have to prioritize the senior citizens and above 45 first before we could move to 18 and above. So due to the extreme shortage of supply, they are being helpless, saying that probably we could, just vaccinate one after the other. So senior citizens and above 45 is the only focus now for both the states. Even Telangana hasn't opened the slots for 18 above. In fact, my sources from the private hospitals in Telangana tell me that the state government has told them that up until June, at least, do not expect 18 above to be vaccinated or registrations to be open in Telangana. Meanwhile, in Andhra Pradesh also, it's extremely due to the shortage. They are prioritizing only second doses at the moment. Only second doses vaccination is going on.
It really doesn't make sense, this thing about not vaccinating young people, even with just one dose, and then perhaps you can increase the gap for the second dose, which is what now the ICMR is also talking about, is that the gap between the first and the second dose can be as high as between 12 and 16 weeks. So that's 3 to 4 months. But I have another question. Does this mean that either Andhra or Telangana, are they ordering vaccines directly from the vaccine manufacturer? Have they placed any tenders or any orders?
Now, in recent developments, the Andhra Pradesh Chief Minister had also written to the Prime Minister saying companies like Bharat Biotech should be allowed to do a technology transfer, meaning probably to companies or players who can replicate the vaccine technology so that the manufacturing increases and they get doses. And right. Both the states, Telangana and Andhra Pradesh, have said that they're open for global tenders. In fact, Telangana has also taken a step ahead with it, talking about how they're open for global tenders when it comes to vaccination. And when the states...
Why don't you do it? When you say they're open to global tenders means what? What is that?
Both the states have said that they're looking at this option as well. But
they're still looking. They haven't placed any orders yet. Like Maharashtra, for example, has already placed an order, and Uttar Pradesh has invited pre-bids they
Yes, that
do it
way
at
both,
local centers.
yes, Telangana and Andhra Pradesh have also done that. They have invited the pre-bids and all of it for that. Telangana particularly, Andhra Pradesh is, I have to check about that particular thing, but Telangana, yes, they did. But both of them said they are going for global tenders here in this particular drive. So,
Okay. Okay, so last couple of questions to you, Rishika, before I let you go. And, let's go back to where you started from, which is that you're in Ongole, in this beautiful beach on the Bay of Bengal. But what is the situation like in the rural areas where you've been traveling?
So, like I said, different parts of Andhra Pradesh, rural areas have a different story to tell, particularly. Now, in areas of Guntur villages, which are slightly developed when you compare to the others, the other belt we're traveling, be it Prakasam or be it Nellore and Anantapur, which are again very badly affected. There, people do have the capacity, the financial stability to afford private hospitals, to go out for treatment. They even travel to Hyderabad for treatment. But as we move further, it gets very difficult. For instance, in Anantapur district, which we are going to go next, a larger population is depend on these jobs, which involve them migrating to neighboring states like Karnataka, or for that matter, come to Telangana or Tamil Nadu. So a lot of them are families, probably lower income or middle class families, who just cannot look at an easy option of private hospitals.
Right.
That being said, when it comes to rural infrastructure, for instance, we visited a mandal called Tullur Mandal in Guntur district, where
Mhm.
19 villages are dependent on one PHC. Now,
Right.
the PHC was supposed to get upgraded to a community health center with 30 beds, but that didn't happen as well. So, for 19 villages, the only way to get a bed is to call the ASHA worker, who will put them in touch with the 104 service, which the state government launched to arrange beds. Then they will again come to Vijayawada town or Guntur to get an admission. So if now the 19 villages population is close to 60,000 easily. So 60,000 people are depending on this particular way to find a bed. So people who do not want to go via ASHA worker, who have, we all know how private hospitals have been working, who have reference and contacts, could get a bed in private hospital, but still would mean you have to come to Vijayawada town for this. Now, this is just one of the 50 mandals, of about 50, 57 mandals in Guntur district. Few of them are better off, they have hospitals there, but more or less this is the situation.
Right, Rishika, I let you go now. And, you haven't been vaccinated. So do keep I see that you're wearing a double mask, which is great. And I think the mask inside is probably an N95. I hope I'm right.
Yes, yes, it is.
Okay, I'm glad that you're wearing both a surgical and an N95 mask. So thank you so much for your time, for explaining in detail what's happening both in Andhra Pradesh as well as in Telangana, and especially in the rural areas. Viewers, thank you for your questions. And we will be following you, Rishika, as you travel across the state. You're watching Eyewitness. I'm Jyoti Malhotra with Rishika Sadam in Andhra Pradesh in Ongole district.